some introductions. So good morning, everyone. My name's Dominique Allwood. I am Assistant Director of Improvement at the Health Foundation. I'm also a consultant in public health by background, and I work out in the NHS on anchor institutions at Imperial. And I've been involved in the Health Foundation's work on anchor institutions for a number of years, and I'm delighted that we have, in the last year, partnered with NHS England to create our Health Anchors Learning Network, which you'll hear a bit more about in a moment. So I'm just going to go through a few ground rules in a moment, and I'm going to get my colleagues also to say a quick hello. I'm probably going off plan slightly. They probably told me don't go doing a round robin of colleagues, but I think it's nice if you get to hear people. So can I just ask people to go on mute though while we're doing that? So I'm going to go over to Sarah. Why don't you say a quick hello?
Hi, I'm Sarah Bordley. I'm a Health Inequalities Lead at NHS England and NHS Improvement, and lead the work on anchors from our perspective, working closely with colleagues in the Health Foundation. And you'll hear more from me in a bit. So I will hand over to Jenna, I think.
Hi everyone, my name's Jenna and I work on the Anchors programme at the Health Foundation, and I'll be looking at all the questions in the chat. So do feel free to pop any questions and any thoughts that you have in there, and I'll be kind of managing that.
Hi everyone, I'm Heather and I'm a Programme Officer at the Health Foundation working on the Anchors programme. And I'll hand over to Tracy.
Thank you, Heather. Tracy, and I'm a Senior Project Manager working with NHS Improvement for Health Inequality.
Oh, you broke up there just a little bit at the end, Tracy, but I think people probably got the gist. So many thanks to the team. There's a lot of work that goes into designing these programs and also prepping for the call. So thank you very much to the team. So I'm going to kick off with just talking briefly about a quick definition of what we mean by anchor institutions. There's a lot of definitions out there, but the one that we're sort of working towards that hopefully will help orientate you for the programme. And then a couple of colleagues are just going to explain a little bit more about the partnership, the network, and the grant funding programme. And I guess trying to sort of be in the spirit of openness, there's going to be a number of questions that I'm sure people have. Some of those we've already pre-thought through what our view is, what we think we're looking for, but for others there might be some new or different circumstances that people have. So we're going to do our best to answer all those questions shortly, but we definitely will make sure that we take questions away if we don't have the answers at the sort of tip of our tongue. And for that reason, we're also very keen that people ask questions in the chat so that we can make sure we capture everything in written form, and then we can also make sure that we will get all answers out for things that haven't been answered back onto our various channels and websites. And for those colleagues who haven't been able to make it today, we are recording the call. So hopefully plenty of opportunity to ask questions, get through as much as we can, and we'll be speedy with the first bit. So you will have seen this definition from the Health Foundation before, but I guess it's worth just reiterating that anchor institutions are large public sector organisations generally that are unlikely to relocate and have a significant stake in the geographical area. So really they're anchored into their surrounding communities, and they have sizable assets in the way that they employ people, the buildings or physical assets they have, the way in which they interact with the environment and natural resources, and who they spend their money with. And it's really in that spirit of the anchor institution work that we're thinking about this grant funding programme. So although we know lots of organisations out there are doing things that align to social value and the mission of anchors, we're very interested in this particular programme focusing on what it means to be an anchor institution and use those assets to direct them in terms of all of those benefits that we see there. So next slide, please, Heather. And many of you, I'm sure, will have also seen our infographic. So we talk about this work spanning across pillars, which include purchasing, facilities, employment, working in partnership, and the environment. But we also think of anchor work as cross-cutting themes. So that can include how we're working with our communities to co-design, the focus that we put on inequalities, measurement, etc. So not only these pillars here, but also thinking very much across the way in which we want anchor institutions to be surfacing the type of work that they're doing. So I'm going to hand over to a couple of colleagues now, Sarah and then Heather, who are going to talk more about the Anchors Network and then a bit more about the actual grant funding programme itself. And then we're going to spend a good chunk of time on questions. So Sarah, over to you.
Thanks, Dom. I just thought I'd just briefly touch upon the partnership between the Health Foundation and NHS England and Improvement. I'm sure many of you are aware that the long-term plan recognised the role of the NHS in contributing to social goals. And one of the key elements and ways of doing that was through the role of the NHS as an anchor institution. And through the long-term plan, the Health Foundation and ourselves came together with a commitment to help spread and scale and enhance the impact of the NHS as an anchor institution. The focus of that has really been is around sort of health inequalities and improving the social determinants of health. And I think with the impact of the pandemic, we can see that now the time is right to really think about how anchors can optimise their impacts. The partnership has got three core aims. It's around raising awareness about the role of anchors and building the capacity of organisations and developing practice and skills to develop anchor strategies and spread and scale anchor practice. As part of this, we'll obviously also be developing the evidence base and thinking about the impact of work, which I know is important to many people, and really thinking about how we can spread and influence this sort of anchor approach into national guidance and indeed national policy to help lever change and optimise impact. Can I have the next slide, please? So one of the core ways that we are delivering this change is through the Health Anchors Learning Network. Through a period of consultation, it was sort of came out that that was really felt to be one of the best ways for us to spread practice and what was wanted by the system. And in August last year, we started on a co-design process for the Health Anchors Learning Network. And we also commissioned the Innovation Unit as our delivery partners for the network. And then the network launched in March. Since then, I think we've had over 1,000 people sign up to be a participant of the network, which is fantastic. And I'm sure many of you are familiar with the range of events and activities that have happened to date already. And as you can see on this kind of brief timeline, we had a gathering, which was like a mini conference, and we've had a whole range of events, blogs, tools, and discussions. And all of that is providing learning outputs that we hope colleagues are finding useful to build on. And also we want obviously people to bring in their own learning and share, so it becomes sort of self-sustaining learning network to that extent. Can I have the next slide, please? One thing that we also wanted to do was really help accelerate and promote practice and get kind of further sort of innovation and test the boundaries. And what we've done as part of that is release this Test and Learn grant funding, which is why you're all here today. And it's open to participants of the Health Anchors Learning Network. And the funding has got two core aims, is to firstly now allow individual organisations to make progress on their broader anchor ambitions, particularly focusing on tackling health inequalities, but also to generate this new practice and this new learning that we can then share more broadly through the network and beyond. And I suppose that's one of the things that we really wanted to highlight today, is that we see this as a start of a kind of learning cycle between the network, members of the network. We're testing new approaches and we're feeding that back into the learning. And so it continues, and sort of really trying to encourage that sort of spread of practice to support innovation and chiefly to enhance the impacts and optimise those. I'm going to hand over to Heba, who's going to tell you a bit more about the grant itself. So Heba, I'll hand over to you.
Thanks, Sarah. So I'll take you through an overview of the eligibility and selection criteria, but all the key information that you need is in the guidance on the Health Foundation website, and we'll also share this in the chat as well. So I'll start with eligibility. So just as HALN is a UK-wide network, the funding is open to applicants across England, Wales, Scotland, and Northern Ireland. So firstly, the lead applicant must be from an NHS anchor institution Dominique took you through our definition of this at the beginning of the call, and we'd be happy to answer questions about this. So organisations are very welcome to apply in partnership with local partners. That includes non-health anchor institutions, health systems, local authorities, charities, regional bodies and networks. So if you're not from an anchor institution, we do encourage you to get in touch with the relevant local organisations to apply in partnership or to share the opportunity. Secondly, we expect that successful projects will be selected in December this year. So projects will need to be able to start from early 2022 and then take place over a 6 to 9 month period. Thirdly, this funding is only open to HALN participants, and we'd like you to name a member of the project delivery team who is a HALN participant. So that ideally would be the project lead. We define the HALN participant, a HALN participant is signed up to the newsletter via the HALN website as a minimum, and there's no time requirement for being a participant prior to applying, but hopefully you have been engaging with other activities or events in the network. And lastly, we're focusing on projects focusing on anchor activities. And what we mean is NHS organisations maximising the economic, social and/or environmental impacts for their local populations. So I'll now move on to the 4 requirements outlined in the guidance. And it's worth noting that we'll use these requirements as criteria to assess your applications. So we recommend that you follow these as closely as you can. Firstly, we appreciate improving health through addressing wider determinants and tackling health inequalities sounds like an ambitious requirement with 25k and a 6 to 9 month project. But what we're interested in here is how you're considering the connection and the impact your anchor projects will have on health inequalities. So particularly how it might benefit your most deprived communities or other population groups in your area that experience health inequalities. And so we're keen to hear how the activity that you undertake as part of your project will deliver or enable some of these expected outcomes. Secondly, we know that NHS organisations are at different stages in their anchor journey. So some will be in the early stages of thinking about anchor activities, and others may have been working on this for some time. However, this funding isn't about how advanced you are and you're thinking about anchors, but it's more about how it can contribute to or catalyse a broader ambition that you have for your anchor institution or your local place. So this project can be focused on a particular topic. For example, it might be one or more of the anchor pillars as defined in the Health Foundation 2019 report, or it might be on a more cross-cutting theme such as measurement. Though we are particularly interested in projects addressing more than one anchor pillar or that generate learning that can be applied across multiple pillars or cross-cutting themes. Thirdly, we're really excited to see the new and valuable learning that will be generated as part of this programme and that will be shared with HALN participants. And so when we say new learning, this can be a couple of different things. So this might be testing a completely new and innovative anchor activity. It might be testing a unique approach to an existing anchor activity, or it might be implementing known anchor initiatives, but in a new context or place where it may not have been done before. And then in terms of how we define valuable, we want to see how learning from projects will be shared with HALN participants so it can be valuable and applicable to other contexts. And lastly, we expect applicants to demonstrate that you've a collaborative approach with partners, with your local community, or we're particularly interested in projects that demonstrate how you'll connect with your local health system. So in terms of how to apply, guidance on how to respond to each question and details of what is required for the expression of interest are in section 8 of the guidance. And so we really do encourage you to follow this guidance while filling out your expression of interest. You'll also see a word limit noted in the guidance, and this is the one that we encourage you to stick to, as it gives an indication of time that we expect you to spend on each question. And so information on how to apply is on our website, and we'll share instructions on how to use Salesforce grants in the chat. And so these are the timelines that we're working towards at the moment. And as you can see, this is a 2-stage application process. So further details of this process are in the guidance, and we can also talk about that in the Q&A as well. But it's worth noting that these timelines are open to change, but expressions of interest will close on Monday, the 27th of September at 4 p.m. So I'll now hand back to Dom, and we'll start answering some of your questions.
Great, thanks so much, Heba. You can stop sharing the screen now, and I'll just make sure that everyone can see us. So we're going to take some questions now. So please, as I already outlined, please do pop them into the chat. If we need to get some clarification from you, we might come to you and ask you to come off mute, but the way that we can capture all the questions will be better in written form. And just to reiterate what colleagues have said, really, we're delighted to be able to offer this funding opportunity, but we recognise that there will always be compromises that we have to make in terms of the design and the choices about what types of organisations, projects and etc. are eligible. And so those are choices that we have made, and we're trying to be clear and transparent about those. And my colleagues will talk a little bit more about those in a moment. So there are a few different questions coming in, and I think I'm going to go to Jenna first. So Jenna, there's been a question about whether the funding can be used to support or employ a member of staff, whether that be temporary or permanent through this programme. So Jenna, over to you to answer that one, please.
Yeah, thanks for that question. And we have had similar ones coming through into the inbox. And I guess what I would say is that even though employment is an anchor pillar, we don't intend that this funding is just used to recruit people to posts. That would probably be kind of to some extent business as usual for applicants. And I guess it goes back to some of the eligibility and requirements that my colleague Heather was talking about, well, what's the learning? What are you doing it in a way that you're sharing learning and benefiting others? And how does that post kind of contribute to a broader anchor's ambition? So I guess the key question there, we understand that projects need resource, so the funding can be used to bring resource in to do anchor work, but what would that person you want to recruit be doing that contributes to those other kind of funding criteria and eligibility? And yeah, what is the learning for other HALN participants, I think would be the thing that we would be asking for as part of that application. Hope that makes sense, but happy to kind of take follow-up questions, or if any other my colleagues have anything further to add.
Great, thanks, Jenna. I'm going to come to Sarah. You're going to get a little bit of a sweep up, Sarah. I think you're going to answer a few questions about the types of organisations that might be eligible to apply, and do pick up anything else you've spotted as well. So Sarah, over to you.
Thanks, Dom. Yeah, there's been a question around are ICSs eligible to apply as an anchor organisation, and there was also one on CCGs. And I know this morning I was asked about social enterprises as providers offline as well. In reality, this is quite a small pot of funding. It's £100,000, and we're looking to provide 4 grants. So we've had to be really tight on what we can use the funding for. And we did think long and hard about who's in and unfortunately who's out at this stage. And we particularly thought about the ICS versus the sort of trust organisation issue, because we know that we're increasingly seeing huge amounts of activity at an ICS level, and the ICS networks establishing, and the role of ICS in social and economic development. However, what we have decided for this grant funding is really to try and focus down on the organisational level, so the hospital or the primary care organisation, rather than it being the system, the ICS, or indeed there's a question in the chat about the CCG, which is the commissioner. So we wouldn't accept lead applications from those. And equally, if you are a NHS provider, such as a social enterprise or a voluntary sector organisation, we've decided it has to be the NHS organisation is the person that receives the funding. But what I do want to clarify is that we really do welcome partnership applications. So where the organisation is working in partnership with, whether it's voluntary sector, education sector, sort of to deliver the work, and indeed welcome that. And in relation to ICSs, which obviously this only applies to England only, we have said within the guidance we would like the organisation to show how they're linked in with the ICS, because we recognise this is really important for us to know that the kind of project is something that's needed and will add value and is based sort of supporting priorities in an area, but also it will help sort of spread within that area. And also we recognise it may also hopefully help support around sustainability, sort of future funding and so on, as the ICS becomes the commissioning body. So in short, it is the NHS organisation that has to be the lead partner, but we welcome partnership applications. If I've missed anything, colleagues, please do jump in.
That's great. Thanks, Sarah. I'll come back to you. I'm sure there'll be more bits and pieces for you to pick up. Jenna, I'd like you to pick up the question that's come up on sustainability, if you don't mind.
Yeah, absolutely, Dom. And I think this is quite similar to a question that's coming from Wayne as well about beyond that 9-month period. I'm assuming it's sustainability in the context of longevity and legacy of projects rather than about the sustainability pillar per se, but feel free to correct me if I'm wrong on that. Yeah, so in terms of sustainability, we are, relatively pragmatic about the size of the grant that we're offering and understand that we need to be realistic in what we expect of sustainability. But I think this chimes with why we are encouraging projects that speak to, I guess, kind of the broader ambition, anchor ambition that organisations might have, and that actually this project might only be a small component of that. But I guess in the full application, we would be trying to tease out how do you expect perhaps the learning or the outputs from this project to kind of hopefully lead on to something else, whether that's kind of directly or indirectly. So yeah, we're realistic about expectations around sustainability, but I guess thinking about how would it kind of support longer term work. And I guess this is where the partnership element comes in as well. If you're working with your systems and other partners, that implies to us that actually there's something more longer term and potentially more sustainable kind of going on here with your project. So that's our view on sustainability.
Great, thank you. Looks like you've also picked up one that maybe Julie's already asked as well. So if it's not clear from the answer there, Julie, but it sounds like Jenna's picked that up, which was about, can it be part of wider work that we're funding? So that's great. Heather, I've had a look at your question. That sounds like a great type of project to be funding. So yes, please do put in this expression of interest. Heather, I think I'm going to come to you. There's a question from Johnny about who the types of assessors will be on. And if you want to pick up any other questions, Heather, that you've spotted, please do as well.
Fab, thanks, Dom. So in terms of assessors for the first round, we're assessing using people from the Health Foundation and from NHS England and Improvement. But for the second round, for the full stage application, we will be bringing people in from VCSE organisations and ideally HALN participants as well. So actually, if you know of anyone who is within the network who would be interested in assessing or who would be interested in getting involved, but who hasn't submitted an application or hasn't been involved in developing an application, then we are really interested to hear from people. We know that I think a couple of people on this call have offered already as well, which is fantastic. So yeah, for the second stage, that is when we'll have more people bringing in different assessors from other organisations as well.
Great, thanks, Heather. Do you want to pick up the one about can an organisation submit more than one expression of interest to?
So within the guidance, we've said that we'll only accept one expression of interest per organisation, and we've asked for a single organisation to lead the application process. And so that lead organisation must then also submit the expression of interest form. Okay, great. I'm just rapidly looking through to see what else is on there. I can see a question about evaluation from Wayne. How will the evaluation of projects be done given such a short delivery time and around sustainability? I think Jenna's picked up a little bit about the sustainability, but Jenna, I might just come back to you. Have you got any further things you want to clarify there, or that's something we can take away and write something more full on? So I'm not sure, Jenna, do you want to see if you can answer that one from Wayne?
Yeah, happy to, Dom, thanks. So the projects, it's unlikely that they'll be kind of formally evaluated, to be honest, just because of the kind of the size of the grant. We don't want the kind of people to use their kind of valuable resources doing delivery, then doing evaluation work. But we are still finalising the requirements for the reporting side of things, which again, we want to be really pragmatic in terms of what we're asking, but we also want to work with successful projects to think about actually how can we kind of tease out the learning in a way that kind of benefits you as kind of grant and award holders, but also benefits participants of the HALN. So trying to think about the best and most effective ways of doing that. At a minimum, it will be a final report, which at the Health Foundation, we tend to kind of ask for quite short and concise reports, but then we might think of ways that we can kind of connect people and try and extract learning throughout your project. So yeah, a pragmatic approach, but no kind of onerous evaluation requirements will be expected.
Great, thanks, Jenna. Sarah, I'm going to come back to you. There's been a question from Rebecca, which says, what's the extent of collaboration with other partners? What would we recommend?
Sure, and if it's okay, I might just add briefly to the sort of evaluation.
Please do, yeah.
Jenna said, is that the actual Health Anchors Learning Network is also being evaluated through a formal evaluation. So although that will not have the capacity to evaluate individual projects, it will think about obviously how the grant funding has helped to sort of support things and be picking up elements of impact where it can. So the question on collaboration, to what extent? There's how long is a piece of string? We absolutely, well, first of all, the guidance is clear that we want you to collaborate and engage community and collaborate with other partners. And there are a number of reasons for that. Is one, we want the whatever activities to be done is to be rooted in local priorities. So sort of understanding what the needs are, and it doesn't have to be the engagement necessarily in that project, but sort of with the community, but based on previous engagement and understanding around priorities. But we also recognise there's a really important role for NHS anchors to work in partnership with other organisations, whether they be other anchors or other sort of partners in the locality. And there's also this idea that the NHS needs to learn to partner and not take over. So that's where we really want to kind of encourage this collaborative approach. But I don't think we can say it has to be 50% of the project or 30% of the project. I think we would just like to see it as being an integral part of the design or the delivery or the continuation and sustainability of the project.
Great, thanks, Sarah. I'm going to go back to Jenna, just to see, Jenna, have you been scouting through the questions to see if there's anything that hasn't been picked up? And we also had a few pre-submitted questions. So Jenna, just over to you if there's anything else you wanted to pick up through any questions that have come in or anything that's come in prior to the call.
Yeah, absolutely. I think we're getting a few kind of questions again about eligibility on kind of CCG. So perhaps I know Sarah was leading on this response, so perhaps she can pick this up. And also, if you have a very specific or personalised question around kind of can we apply with this combination or that combination, we can also pick up those via the anchors inbox as well. Yeah, we did have a question just around what is the expectation for like the full application and what does the kind of latter bit of the process look like. So I just wondered whether Heba, I know you've been working on this, can say a little bit more about what we'll be asking for the full application.
Yeah, happy to. So for full application, we'll ask you to expand on your expression of interest. So asking for further information about the need that you're hoping to address, how you'll measure your progress, how your work will be resourced, and also a more detailed project plan. But it is worth noting that the full application will be assessed against the same criteria outlined in the guidance in section 4. And so for full application stage as well, we may also invite applicants for an informal interview to discuss their project as well. And that's outlined in the timeline and the guidance as well.
Great, thanks very much, Heba. I'm just picking up a couple of the pre-submitted questions as well that we've had, which I think we've covered off, but I think hopefully people are clear about what it means to be a HALN participant. That's fairly light touch. We do want people who are members of the network, but you don't have to have been a member for a particularly long period of time. And also just something on the language as well. So whilst we're putting this under the umbrella of our anchor institution and Anchors Learning Network, we recognise particularly in some of the devolved nations that the term community wealth building or other terms is used very synonymously with anchors. So if the project is very strongly focused on social value or community wealth building, but you don't necessarily call it anchor institutions, we'd also welcome either a conversation or expressions of interest on that. I know there's a few Scottish colleagues on the call, so we're really looking forward to hopefully receiving some applications from those. I'm just scanning to see if there are any other questions coming in. So please do submit any others that you want to. I'm going to go to Sarah just to see, Sarah, is there anything else you wanted to add either on the CCG point or any further thoughts on the questions that have come up, etc. And yes, of course, Johnny Welsh too. We're looking forward to hearing applications from you. Sarah, is there anything else you wanted to add?
I think John, you might have answered the CCG question in the chat. I think what we are saying is that the lead partner, the person who will receive the funding, has to be an NHS trust or a equivalent in one of the devolved nations. So it's all primary care organisations. It's the organisation. So it's not a CCG and it's not an ICS. And I'm sorry, we've just had to curb it here. There are other ways that we support and sort of channel money through CCGs and ICSs, but unfortunately through this fund, we're looking for the lead partner to be the delivery or the provider, an NHS provider. But as we've said, we welcome partnership working and really recognise the importance of the CCG or the ICS being sort of tapped in and keyed into the work. I didn't know if it was helpful to kind of sort of moving on from that question. I didn't know it was helpful to kind of really stress out interest in kind of really developing new approaches, and that's what we're looking for, and sort of generating new learning. On the Health Anchors Learning Network, there is a lot of increasing amount of good practice, and we always welcome people to share their good practice that they're developing through the Futures platform at any time. But what we know, I guess we hear a lot of what makes a good anchor, what's the sort of model, where can we really go with this, how do we know we're having an impact? And I guess we're really keen to think about new approaches, whether that's sort of focusing on a population group that we haven't heard that much about. We know there's not to say any of it sort of whether we're thinking about employment, but employment for a particular group like care leavers or homeless, or I know I've had questions from people before about kind of aging well, what's the role of anchors with older people. There are kind of some areas that we feel a little bit untapped, but equally that's not to say areas that are already have been explored. How can we stretch the boundaries of that? How can we push that further or apply something in a new situation? So I just sort of really wanted to stress that new innovation that we're looking for as well. And colleagues do jump in if you feel like I've missed anything there.
Great, thanks, Sarah. I'd like to reiterate that as well. There's a lot of great anchor work going on, and this is about how we help people see some of the newer type of innovative work, or something where people could really benefit from learning from an approach. And this really is about learning to spread new and best practice across all of our work and partnerships. So please do bear that in mind. We've had a question about the application and its format. So I think I'm probably going to ask Heather to pick this up about application in Word documents rather than Salesforce, or as well as Salesforce, apologies. Heather, why don't you jump in just on the format of some of the applications?
Yeah, happy to pick that one up. So we're only accepting expressions of interest that are submitted via Salesforce, but completely understand that actually it might be easier to have a look at the questions beforehand. And those are in section 8 of the guidance. So all the questions are that we're asking you to fill out, including the word limit that we're asking you to stick to, is in section 8. So please do have a look. But please do get in touch also if it is easier to have a specific form with the anchors inbox, and we can send that over to you. But we'd ask that all of that information is copied over and kind of submitted via Salesforce.
Thanks, Heather. Just going back to the conversation we were having just before that question around potentially new learning, and we also want to stress that we recognise lots of great existing work is already going on. So this doesn't have to be brand new projects that are started for this work. And I think Jenna's going to just come in and explain a little bit more about how this fits alongside things that people are already doing. So Jenna, over to you.
Yeah, sure. So we've asked for projects that are within a 6 to 9 month time frame, and for some people that might be the perfect time frame to do the work that they want to do and fit together nicely. But I guess the realities of some of the work that you're doing is that it might be a bit messier, a bit more complex than that. And we do acknowledge that actually you'll be doing the work within this time frame, but it might be connecting to other work, or the timeframes might be kind of just a bit more complex than that. But I guess what we're really getting at is that we just want to share the learning from this work in 2022. So that's why we've given that 6 to 9 month time frame. So as long as kind of the majority of your learning we can share with HALN participants is within roughly that time frame, then if your actual work goes on a bit longer, or it connects to kind of other work, or if you've got match funding for something bigger, but as long as like that component part, we can get some kind of benefit out to HALN participants in 2022. That's kind of really what we're gunning for there. But again, happy to take more specific questions on that, but just wanted to kind of make that clear.
Great, thanks, Jenna. I'm just looking at the chat. I can't see many more questions coming in, so I'm going to just deviate off plan a little bit, having said only write questions in the chat. Just give people a chance to verbally express any thoughts or questions they want to by just popping a hand up, and we can just bring your voice into the call. Otherwise we sound all slightly like faceless people on the chat. So if anyone wants to come in with either a comment or a question, happy to take that now, and if not, then we will wrap up it slightly earlier if we've managed to cover everything. So I'll just pause, have a look and see if anyone wants to pop a hand up. I can see lots of warm, friendly colleagues on here, but I'm sure you've hopefully all had your questions answered. Okay, doesn't look like anyone needs to. So I'm just going to go round my panel colleagues and just see if they want to add any final thoughts of good luck or insights into anything they've heard. So Jenna, while you're on screen, anything else to add from you?
Thanks, Dom. I don't think so. I think just to acknowledge some of the points that we've been making around, we know that, you know, the definition of anchors is a bit fuzzy and people call it slightly different things. So if you do have any questions, is it this or is it that, then please do kind of come to us and ask us any questions. Ditto where we've said, you know, it needs to contribute to a longer term ambition and things like that. We've tried to define it as best that we can, but, you know, people view these things in slightly different ways. So do reach out. I think the key thing here is around, is it going to kind of boost your own anchor work? And by doing that, is it going to contribute like really helpful learning for others who are trying to do the same? That's really kind of the ethos behind this kind of grant funding. So yeah, I think that'd be my final thoughts.
Thanks, Jenna. Sarah, any final thoughts from you?
Yeah, I did want to pick something up actually. I was thinking a lot of you might be thinking, oh, I could put in an application and there's only 4 grants, and is it worth the energy and worth it? Well, I want to say yes, because one, we are part of this is we're really excited to find out what ideas and opportunities there are out there. And, you know, we will find a way to help support those activities as much as we can, even if it's not through financial resources, you know, whether we put on some learning sets or a kind of an event where we can talk and share through ideas, particularly if there's sort of projects that have similar threads. And we just want to kind of hear about all the ideas and opportunities, because it might spark off future opportunities that we can support. So please don't let it put you off in the thought of, well, it's quite a stiff competition, because we think that there are ways we can support your project, even if it's not financially.
Great, I love the encouragement, and sometimes on these calls when we talk about all the things that you can't do and all the eligibility criteria, it can feel a little bit daunting and off-putting. So we hope that we've tried to make it as obvious and straightforward as we can. Please do bear in mind what Sarah said. We're really, really interested. It's just the part of the reason we've designed it with the 2-phase thing is the expressions of interest will really give us a sense of what people are doing and the interesting work out there and how we can support in multiple different ways. So that's fantastic. We have had another question. That's great. Zoe, is there a limit to the number of applications coming from an ICS area? Could 2 or 3 trusts in one patch put in an application? My sense is no, there wouldn't be a limit. We would be happy to, as long as it's individual trust only, putting 1 expression of interest per organisation. if different organisations within that area want to put in applications, even if they seem very similar, we would accept those. So please do put those in. Thank you, Zoe. I'm going to go over to Heba for any top tips now. Heba, final top tips from you for applicants.
Thanks, Dom. I think the key thing from me would be, this isn't a closed conversation, so please do get in touch with any other questions that you have or any other clarifications that you might need. So in terms of next steps, we'll share the recording of this, but we'll also publish other FAQs that we've received by early next week, and we'll continue to update those. So please do check in on the website to see if those have been updated as well, and we'll also email you when those are up there. But I'd completely agree with what Sarah said. We'd love to hear from you, and yeah, please do let us know if you've got any questions.
Great, and really keen, as we've iterated, that we're looking for people who want to work in a collaborative way, and share learning, and think about their partnerships locally. So that the more you can do that, the stronger hopefully those applications will be. I just wonder if Tracy, did you want to add anything else? No pressure, Tracy, but making sure that you're part of the team, you get to say anything else that you wanted to.
Thank you. Just to reiterate what my colleagues said, we're here to help. Feel free to contact us. Look at the FAQ. There's nothing that's covered in there that doesn't answer your query. Get in touch with us and go for it. Good luck.
Right, okay, well, on that note, I think all the questions have been answered. Oh, we've actually got a hand up. I'm sorry, Emrit, I didn't see you, just in the nick of time. Emrit, do you want to come in?
Just really quickly, and I'm just going back off, sorry, Jen, I didn't realise that emailed Jenna privately about my question. My question is around, sort of, you just alluded to sort of collaborative working, but my role sits in that truly collaborative form, in that I'm substantially, my substantive role is employed by the CCG. I am now on secondment to the local authority, and I'm the leading on health inequalities and anchor institutions, and I am working in connection with our local trust. So while I have been sort of seconded, etc., I'm the member of the network. I'll be leading in our health inequality steering group. I'm leading on the anchor institution network. Although I'm not an employee of the trust, can I apply on my behalf? Because it'll be sort of my proposal within that steering group. And I understand what you're saying, it needs to be the trust, but I am sort of working in the trust with the trust, driving this forward.
So we're looking for the named organisation to be the NHS provider organisation that we've kind of talked about. But Emma, it sounds like you'd be absolutely key as one of the project team members, and in fact one of the key sort of leads of that. So I think it's about just finding that balance about how you get the organisation on board to be able to be eligible, but obviously you've got a lot of the ideas and the kind of remit across this. So absolutely think that sounds like a great set of collaboration to try and make work through an application. But if there's queries about how you specifically might set that out in the application, do let us know.
Right, no problem. Thank you. Thanks
okay. I'm just looking to see if there's anyone else on hands up. I don't think there is, so I think we can probably finally say thank you so much for joining. We hope that this has sparked interest, and hopefully that you will feel encouraged to apply. We're really looking forward to seeing the applications. Please do reach out if you've got any questions or uncertainty about what's there. As we said, unfortunately, we have had to make some design choices. It's not something that we can do much about when we've only got a finite amount of money and a finite amount of time, but we're hoping to try and be really transparent about what that is. It's not the end and be all of the support that we will be looking to offer in the future through the HALN, but a first sort of foray into this. So please do get in touch if you've got any questions, and thank you very much for joining. We'll make sure that we pop all the answers up through the various channels that we have been promoting as well. So thanks a lot.
Thank you.